Thank you so much for the opportunity to talk about our work examining baseline patient-reported outcomes and their association with hematopoietic stem cell transplant complications, or HCT. Patients who receive hematopoietic stem cell transplantation can often undergo a curative therapy in a variety of hematologic malignancies, but transplant can be associated with significant toxicities, including acute or chronic graft-versus-host disease, or GVHD. In addition, it can be at risk for intensive healthcare use. In many areas of oncology, the importance of patient-reported outcomes has grown in terms of its relevance and what we understand about that. And in fact, in transplant, we've seen association of patient-reported outcomes with survival. However, the association of baseline patient-reported outcomes and complications of transplant, including healthcare utilization and graft-versus-host disease, are poorly understood. So to address this, we did a secondary analysis of 2 supportive care trials at Massachusetts General Hospital. There's 250 patients, all receiving an allogeneic autologous stem cell transplant for a diagnosis of a hematologic malignancy. Within 72 hours of transplant, we assessed baseline patient-reported quality of life, fatigue, anxiety, and depression through validated scales that have been used in oncology patients. And we assessed their association with essentially healthcare utilization outcomes and then acute and chronic graft-versus-host disease, and used regression models to assess the relationship of these baseline factors with these outcomes. A couple of things I want to point out just for patient characteristics to highlight. So in the cohort, the median age was around 60 years. The most common diagnosis was acute myeloid leukemia. About half of patients had an autologous transplant, about half had an allogeneic transplant. In the allogeneic cohort, which is the only cohort where we looked for graft-versus-host disease, the most common type of transplant was a matched unrelated donor transplant. The most common prophylaxis regimen for graft-versus-host disease was tacrolimus and methotrexate. About half of patients had a myeloablative versus reduced intensity transplant. In terms of these patient-reported outcomes and associations, we found that a higher baseline anxiety was associated with a greater likelihood of hospitalization in the first 100 days after transplant. And we also found that lower fatigue scores were associated with more days alive and out of the hospital. So in other words, fatigue and anxiety were associated with intensity of healthcare use in terms of those patient-reported outcomes. Interestingly, with acute graft-versus-host disease, we found that quality of life, fatigue, and depression were all associated with likelihood of developing acute graft-versus-host disease in the first 100 days. And that was essentially that worse quality of life, higher fatigue scores, and higher depression were all associated with a greater likelihood of acute graft-versus-host disease. We did not find an association of these with chronic graft-versus-host disease in terms of baseline outcomes. So what are my main takeaways from this? First of all, we can see that baseline patient-reported outcomes can be associated both with intensity of healthcare utilization and with complications of acute graft-versus-host disease. And so this lends support to the implementation of more routine patient-reported outcome collection in the transplant population. And I think future research could look at the role of supportive care symptom monitoring interventions and potentially pre-rehabilitation interventions to see if we can actually make an impact in both of these outcomes. Thank you very much.